It's been a year since a baby formula shortage began impacting families in Canada and the U.S. And while things have somewhat stabilized in recent months, supply, well, it's still pretty limited. One Toronto mother says she's been desperately searching for her baby's usual formula over the past few weeks, but has come up empty-handed.
I looked on the Government of Canada's health website for infants, and it does say that there is an adequate supply of formula to feed Canadian babies. But I just feel that I don't know how that can be when I've gone to stores and I've contacted about 20 to 30 stores easy.
Christina Morella typically buys Nestle's Good Start liquid formula for her 8-month-old son online. But a few weeks ago, she noticed every site was showing out of stock. Last week, when her own supply began dwindling, she ventured out to a few pharmacies and big box stores.
And I noticed that the shelves were pretty bare.
Major gaps on every store shelf. Some retailers, like this Walmart in Etobicoke, limiting purchases to 2 per customer. Morella says she was told by a Nestle representative to try the powdered formula instead, or even to switch to another brand. But the new mom is worried about how that might affect her baby's stomach. As a temporary measure, she's now switched to the ready-made version of the same product for double the price.
Of course, it's very difficult given the economy right now and how everything has gone up. I'm also on maternity leave, so obviously my pay is cut as well.
We don't see how things will get resolved anytime soon.
Food professor Sylvain Charlebois says much of the problem has to do with ongoing issues at the Abbott infant formula plant in the U.S. Its closure over sanitation problems last year was the source of the original shortage. And in January, the U.S. Department of Justice began investigating the plant's operations.
They don't seem to be in compliance with many of the FDA rules. So there's lots and lots of issues there. It supplies many of the products we actually consume in North America. So we're actually still expecting inventories to be tight for quite some time.
With Abbott products like Similac off store shelves, alternate brands are having a hard time keeping up with the sudden rise in demand. In a statement to CityNews, Health Canada said it expects the situation to stabilize, quote, over the next few months, adding in part, "We understand that this is a difficult situation for families already facing rising costs of living or whose infants are having difficulty adjusting to a new product, and we are working tirelessly to improve supply." The agency says it has already authorized the temporary sale of over 70 products from other countries to help ease the effects of the shortage, and is working with manufacturers to increase shipments of products normally found on the Canadian market. In Toronto, Natividad, City News.